First we will go through the venous anatomy to know just before varicose vein. The venous anatomy of the lower limb can be divided into three systems. One is superficial, deep and venous system and perforators. Venous anatomy. The drainage of the lower limb consists of two systems, the superficial and deep venous system. The superficial system is located in the subcutaneous tissue, whereas the deep system is located in the deep fascia of lower limb. The veins of the deep system accompany the vessels of arterial system. In the foot, deep veins drain into anterior tibial vein, plantar vein drain into the posterior tibial vein, the medial malleolus. The posterior tibial vein scenes drain in the popliteal vein. After passing through the anterior compartment of thigh, it is then known as femoral vein. If we follow the femoral vein, proximally we can see it receives tributary, which is the deep vein of thigh, the profunda femoris vein, and this vein accompanies the profunda femoris artery. Now the femoral vein passes beneath the inguinal ligament, and this is known as external iliac vein. Then external iliac vein joins to internal iliac veins to become common iliac vein, and the both common right and left common iliac vein joins to form the inferior vena cava. The superficial venous system, it consists of two veins, the small and great saphenous vein. Small saphenous vein runs along the posterior aspect of leg. Dorsal venous arch drains in dorsal aspect of foot, and on the plantar aspect of foot we have plantar venous arch, which drains in plantar structures, which drains the plantar structures. Looking at the lateral aspect, the small saphenous vein arising from the lateral aspect of dorsal venous arch, passing behind the lateral malleolus. The small saphenous vein that proceed and ascend posteriorly to the level of the knee, and it drains into the popliteal vein behind the knee joint. The great saphenous vein starts at the dorsal venous arch and passes anteriorly to the medial malleolus and runs along the medial aspect of leg along the entire length of lower limb. It then drains into the femoral vein. Now comes to the third thing, that is perforators. Perforators are these perforators connect superficial to deep venous system at various levels. They travels from superficial fascia through an opening into the deep fascia before enters into the deep vein. There are multiple perforators present at the level of foot. There are 4 unnamed perforators at foot, that is more dorsal, medial, lateral, plantar, and 3 ankle perforators. The perforators present in leg is divided into medial leg perforator, anterior, lateral, posterior, intermalar and para-ankylosing perforators. And the thigh perforators are medial thigh perforators, anterior thigh, lateral thigh, posterior thigh and pudendal perforators. The venous valves. Venous valves are abundant in the distal lower extremity, and number of valves decreases proximally, with no valves in superficial inferior vena cava. These valves prevents reversal flow in the vein, ensure that the blood is pumped from the superficial to deep venous system and back toward the heart when patient is walking. The factors which helping in venous return: the negative pressure in the thorax, which is very important, calf muscle pump, arterial pressure transmitted to the venous side through papillary bed, veni commitants and competent valves. These all helps in venous return. Then we will go through the varicose vein. The varicose veins are defined as dilated, elongated, tortuous and palpable superficial vein as a result of venous hypertension. The various risk factors causing varicose vein are occupation, prolonged standing, age, immobility, raised intra-abdominal pressure, DVT, oral contraceptives, obesity, pregnancy and aging. The some epidemiological factors which precipitate to varicose vein, these are age, pregnancy, gender, 3 times more common in females, the job, prolonged standing at one places and prolonged sitting, hereditary is also a contributing factor. The pathogenesis of varicose vein is shown in this slide. Now we will go through the pathway of varicose vein. The etiological factors causing enlargement of veins: veins are stressed and becomes incompetent. Backflow to the venous blood further increase distension of vein, and the clinical manifestation comes. The clinical features of varicose vein are dragging, lacking pain, heaviness in leg, nocturnal cramps and muscle fatigue, edema, itching, discoloration, ulceration, ankle edema, postural discomfort and cosmetic disfigurement. The clinical signs are elicited in the form of Brody-Stendelberg test to test the saphenofemoral junction incompetence. Brody-Stendelberg test 2, the 1 is for saphenofemoral junction incompetence and the 2 is for perforator incompetence, and the 2 tourniquet tests are done for perforator incompetence. Various clinical signs can be elicited with the Schwarz test, modified Perthes and Fagan test, which can be discussed later on in detail. Pratt's test and Morris's cuff impulse test. There are various classifications present to classify the various intensity of varicose vein. These are depend upon the various type of classification. One is CEAP classification, that is clinical, etiological, anatomical and pathophysiological. One is clinical classification according to the severity of varicose vein. Etiological classification, anatomical and pathophysiology. There are various kind of classifications are present in this. The investigation and diagnosis depend. The main diagnosis is depend on the history and physical examination. Other investigations are duplex ultrasonography. Presence of DVD perforator location is identified with the sonography. Site of incompetence and reflux stressing can be identified. The venography, ascending and descending venography can be done to know the varicose vein. The complications of varicose vein: venous ulcer, pigmentation, eczema, dermatitis, Marzolin ulcer, DVT, recurrent thrombophlebitis, lipodermatosclerosis, hemorrhage and calcification. These are the common complications due to venous varicose vein. The mechanism of varicose ulcer is wall incompetence and chronic venous hypertension leads to defective microcirculation, RBC lysis, hemosiderin and deposition, dermatitis, capillary damage and chronic vessel ulceration develops. The management of varicose vein divided into 4 parts. One is conservative management, other one is medical management, non-surgical interventional management and the surgical management. In conservative management, the important thing is the main cause behind the varicose vein is prolonged standing. So we just have to avoid the prolonged standing in the conservative management. Apart from this avoiding prolonged standing, the crab bandage and elastic stockings from toe to thigh, which causes decreased edema, venous volume and reflux increases the venous return. The limb elevation above the level of heart while lie down also help in to reduce the varicose vein. Graded compression stockings and the Anna boots are available. The medical management also includes calcium dobesalate tablets are available, which is taken 500 mg twice a day. It improves lymph flow and reduces the edema. The other drug which is available is combination of diosmin and hesperidin. It relieves night cramps. The non-surgical intervention management includes sclerotherapy. Complete sclerosis of venous wall is done in cases of uncomplicated perforator incompetence, small varices, recurrent varices, isolated varices and unfit and aged patients which cannot be taken for surgical management. And the sclerosant used are sodium tetracyl sulfate, sodium monourate, ethylamine and polydecanol. The sclerotherapy techniques are in this sclerotherapy technique we just introduce 23 gauge needle and it enters with the sono-guided procedure and the sclerosing agent is injected and the compression bandage is done later on. Non-surgical intervention management also included. Nowadays laser ablation is also a good technique to treat the varicose vein. USG guided laser ablation is done for long saphenous vein. The surgical management are the various surgical procedures available for treatment of varicose vein. One is Trendelenburg operation. In this operation, some complications may be seen just like hematoma, infection and saphenous nerve injury. So we have to be cautious during this surgery. Thank you.